When I saw Adelaide for balance concerns, she had a right-sided limp when she came in. She underused her right leg for sit to stand. When she did tandem stand, she tipped over to the right consistently. Either foot, it was always to the right. I'm thinking, if it's your right shoulder, maybe that explains your weakness, but what does that have to do with your right leg? Suddenly I'm thinking TIA or CVA or something. So I sent Adelaide for a CT scan, and it was not a stroke. It was a glioblastoma. So not a great outcome, but again, the best shoulder therapist in the world isn't going to identify those kinds of things. Functionally focused examinations, even very brief ones, can be done in any clinic to identify early predictors. Any idea, before I pop Goldman up here, what some of the predictors of mortality are?
Efficient locomotor.
Inefficient locomotor.
Yes.
Any other ideas? False. Any other ideas? Fractures.
All locomotor.
Y'all are right. All of those things are locomotor, correct? But y'all are being way too thoughtful on these things. There is strong merit in identifying these things, regardless of our care, and we should consider using these in healthy populations. Josh and I were chatting 2 days ago. Who is going to pay for us to do an intervention on a healthy patient? If we prevent the fall from happening, who's going to pay for the fall? There isn't necessarily good reinforcement to do preemptive, preventive, early screening, but that's the way that we intervene early. Of the 25 factors most associated with mortality, several of these could be assessed very quickly in clinic. Sit to stand, gait speed, hemoglobin A1C, inflammatory markers. These are roughly half of the list that Goldman established of the 25 predictors of survivability or mortality.
Can add liver function.
Liver function tests are newer. Again, this was 2016, and the liver function test, the metabolic syndrome, is a newer phenomenon. Although inflammatory markers can cover some of the liver function. So here's Bob and his back pain. The doctor said, just give him a TENS unit. He doesn't exercise. He has high BMI. His A1C was 6.8, and he sits at home and feels depressed. What Bob needs is not a McKinsey exercise program. He needs a referral to psychology and social work and an exercise program, not a TENS unit, not a yoga program. Physios should consider using performance measures on adult populations, like the gait speed and the sit to stand and those types of things. Adelaide, we talked about this already. And the glioblastoma was showing up by a globalized right-sided weakness. No reflex losses, no hypertonicity, no wasting away, no atrophy, because it was very early on. But the shoulder therapy didn't pick up on that. So these syndromes, these symptoms, these red flags leading to, have we identified the elephant in the room? Falls, frailty, failure to thrive, poor quality of life, premature mortality. These are actually highly prevalent in societies. They are multifactorial and complex, is why we miss them. We're not looking for complex things. We're looking for rarely seen things or things that are specific to our expertise. Associated with substantial mortality, very poor. Glioblastoma does not have a great outcome, I'll tell you that. High expenditures as we are caring for people, decade after decade after decade, they're in long-term care. They don't get to rehab soon enough, like Lisa was talking about this morning. So there's a delay in care, and then they discharge home. That's family burden. It's taxing on staff and resources. These patients are often over medicated because they have multiple things going on. So they have pain, let's give them a pain med. They have cardiac problems, let's give them a cardiac med. Now they're orthostatic, let's give them that. Then they get depressed because they can't be active, so we'll give them an antidepressant and refer them to another provider. So these are very difficult cases, reliant on family support. This is Bob. He goes to the store and then has to call an ambulance because he falls down and can't get home, right? So this is what has been identified as the population ages. This is the impending global health crisis, is older people living without a quality of life, living but not functioning, living but taxing on the healthcare system. So what do we do about this? Continue on, right? I propose that we need to be more preemptive and more proactive. And we could assess some of these markers in 40-year-olds who aren't falling down and who aren't in the wheelchair and who don't need the rehab. 72 was your average age? 76. What if we start 20 years earlier in the mid-50s prescribing things to prevent some of these problems going on?
Here we go. Okay, 40s for female, because.
And that's why the talk was called the 40 to 65-year-olds, yes.
It's not postmenopausal, it's pre-menopausal.
Gait speed, sit to stand, and static balance have been suggested as preclinical tests that could be done on middle-aged patients. This is primary care. This could happen in primary care. In my Monday through Friday work, I am in a primary care clinic. Some of you are not primary care providers, but these tests could be done preemptively early on. This was 2 different articles stating basically the exact same thing. There was a book, it's now in its like 4th or 5th iteration. It was very amusing to me. It's rude, it's written very crude and in your face, but what if I don't want to get sick and go to the doctor? What if I don't want to break a leg? Medical practices aren't set up to be preemptive. Doctors are often not trained for this, and insurance certainly isn't willing to pay for something that hasn't happened yet. Something like waking up dead. Nobody wants that. So, Lisa talked about gait speed. She had a cool slide up this morning, which I actually took out of this presentation last month. So I'm glad you had it. Thank you for showing the little bar graph of gait speed and function. However, gait speed shows high sensitivity and excellent predictive ability for what? Future disability. So I do a reflex test. What does that show? A reflex loss that has already happened, right? I do a strength test. What does that show? Strength that is already lacking. I do a liver function test. What does that show? A liver that's already not working well. Declines in gait speed can preemptively identify those problems years or even decades before.